Thank you everyone for attending the virtual open house for the Master's and Graduate Certificate in Population Health Management. I'm Kelly Curtis. I'm one of the admissions officers here in the Department for the Applied Science Programs, and I work with our team to assist students as they are exploring their options for continuing their education. I would like to introduce Dr. Biddle, the Program Director, to share more about his background.
Thanks, Kelly. Hi, everyone. My name is Mark Biddle. I'm the Program Director for the Population Health Management Program here at Johns Hopkins School of Public Health. I'm also the Program Director for the Master's in Health Administration at the School of Public Health. I have 35 years of healthcare administration experience. I have been teaching part-time for the past 20 years, full-time for the last 3 years, and I'm currently a senior scientist in the School of Public Health.
Thank you, Mark. Today's agenda will include an industry overview. We'll cover program details both on the master's as well as the graduate certificate, insight into the curriculum, what online learning looks like here at Johns Hopkins. Faculty members will be highlighted, and we're pleased to have alumni presenting today. I will cover the admissions requirements, and I'll touch on financial aid as well. There will be time at the end for questions, so if you have any questions that come up during the presentation, please type those into the chat box, and we'll address those at the end of the presentation. Dr. Biddle, feel free to start.
Great. Well, thank you, Kelly. Again, welcome, everyone. Good morning, good afternoon, depending on where you are. It's my pleasure to talk to you about our population health management program. As you saw on the previous slide, one of our core beliefs is that we as healthcare administrators need to develop new competencies to allow us to effectively navigate and succeed under this new realm of value-based reimbursement models and moving even further towards population-oriented health delivery initiatives. So in the way of context, we developed this program in response to what we saw evolving in our U.S. healthcare system. Of course, we have a very fragmented and expensive healthcare delivery model, one built on hospital-based acute care for the most part. With this change from volume to value, we've noticed and have seen demonstrated significant demands for accountability in how we manage our healthcare resources, particularly in light of the fact that we spend more than any other developed country, and of course our outcomes are much poorer than those countries. So we have been looking over the last many years at developing a program that really blends the best of both healthcare administration and public health into this notion of a population health management program. By doing so, it allows us to bring in this focus on determinants of health, which is a big area of focus now, as well as thinking beyond the four walls of the traditional hospital. So this population health management allows us to, again, take the public health practice tools that we know work, evidence-based, and merge them in with management and delivery of healthcare services as we rethink how we want to deliver health in our communities, not just healthcare. So I have worked very closely with Dr. Sharfstein. He's an associate dean for public health practice in our school, but he's also the former secretary of the Maryland Department of Health and Mental Hygiene. And he, I think, said it very well that, population health managers who draw upon public health tools will be the leaders of tomorrow's healthcare system. And that's really the goal of this program, as I say, is to bridge what we know works from a public health perspective and being able to apply that in the healthcare delivery setting so that we can think about how to be more effective in developing and implementing population health management strategies, not only through our hospitals and health systems, but also as effective collaborators across sectors. Next slide. So as indicated here on the slide, we are very focused on developing this population health management program. We launched it 3 years ago now. This will be our moving into our 4th admission cycle. It took about a year to pull the process together, in part because we wanted this to be very interdisciplinary in nature. So as you'll see on a later slide, that we are involving many of the departments within the School of Public Health. Our faculty are both full-time faculty as well as practitioner faculty, which brings knowledge and experience to the content that we deliver. The degree that you come out of this with as a Master of Applied Science, that word applied is very appropriate to this degree, because the program is really built around practical applied methods to improve and to manage population health. So this interdisciplinary program, again, is really geared towards helping those in the healthcare sector be able to develop effective strategies to really lead more successfully in a value-based, population-focused model to improve accountability and quality. The curriculum also, as I say, talks about a lot of things that we think about from a public health perspective. Most certainly the determinants of health. We look at how to integrate medical care, public health, genetics, personal behavior, and lifestyle, all significant influencers of health in our communities, so that our graduates really can help lead, again, effective conversations in developing health in our communities. Next slide.
Hi, everyone. Sorry about that. It looks like...
No, I'm here. I'm sorry.
Are you back? Okay.
Yes.
Thank you.
My apologies. So I mentioned this earlier, but our program is really geared towards clinicians and managers that are actively engaged in working in their hospitals and health systems from a population and value-based approach. We have current enrollees that are medical directors, CEOs of health systems. You'll hear from an alumni in just a moment relative to her position, but really it spans all aspects of not only the healthcare delivery system, but we have a number of our students who come from the pharmaceutical industry. Many of those large pharmaceutical companies have and are developing population health management departments themselves, the payers as well. So again, we have a good cohort of applicants and admitted students that represent a number of the key sectors that are very relevant and very much involved in population health management. Obviously, this seems to be growing. I've been, sort of tracking this myself by just looking at the types of jobs that are available when you do a job search. It's one of the ways that I tend to keep an eye on what's happening in healthcare, is just look at what kinds of people are being hired, what kind of roles are being hired, and clearly population health management is one of those that's on a upward trajectory. So we think this is a program that's really geared to geared to members across sectors, not just healthcare. And as you can see, some of the job titles that we see our folks going into, or actually that are already in these jobs, who are coming to our program to help get a better understanding of just what population health and population health management means. When we created this program and launched it 3 years ago, it was a very new thing. I used to go around the country and talk to people, talk to boards, and I would ask them, how many of you are talking about social determinants of health in your board meetings? And I might see 1 or 2 hands out of 30 people in a room. And today, now, you probably see most people raising their hand, and they've heard about it, they're talking about it, but do they truly understand it? And so what the purpose of our program was really to help provide some evidence, albeit developing evidence, to some of the key things that are working well, people's actual experiences, so that we can guide individuals in their own pursuit of population health. Next slide. So some of the details, I'll go over this probably a little bit more on the next slide. It'll make more sense. But so we offer 2 elements to our program. If you can enroll as just a certificate student, which means that you'll take approximately 25 credits, and you can complete the degree in 1 year if you take 2 classes per term, or you can complete the certificate in 2 years if you take 1 class per term. You can apply for the master. So you could apply for their certificate, complete it, and then decide, hey, this is really helpful. I want to go on and get the master's. You can do that. Or you could just apply directly to the master's program, in which case you would have up to 4 years to complete the degree. You could do it in 2, again, if you took 2 classes per term, or you would have up to 4 years if you took 1 class per term to complete all the credits. These are all, again, related to a variety of courses, which you'll see in a minute in terms of the things that we do cover. At the end, your final term within the school is an integrative activity. Another way of thinking about that is a capstone. So this would be a project that you would need to complete at the end. This is very skills-based, as I mentioned earlier, very applied in nature. We want this to be practical. We want you to be able to take the information that you learn about in the class and go right back to your offices and be able to apply it. I'm always thrilled to see emails from students when they say, you know, I was sitting in a meeting today and we were talking about the very thing that we've been talking about in class. This is a part-time program, which is great. Again, you have the ability to complete the certificate in 2 years or the master's degree in 4. It's 100% online, so there's no residential component, meaning you don't have to come to Johns Hopkins, although if you're ever in town, please, I welcome you to stop by and see me, see the school. But we certainly would enjoy your company for graduation. We just graduated our first cohort of students from this program this past May, and it was so wonderful to see that all of them came to graduation. So it was wonderful to meet everyone face to face. So this is a very contemporary program in terms of the way it's been designed. There is the opportunity for group work, group learning. These are all experienced professionals, and I venture to say that you will learn as much, if not more, from your peers as you will from the program content itself. So it's very important. I know we think it's a really strong point to our program that we have folks from across the country that are participating, and you get to hear about their experiences and learn from what they're doing and develop, really good network of contacts that you can reach out to for a variety of things in your day-to-day lives. So our program is built around this concept of being applied. So it is very hands-on and very skills-oriented. Next slide. So this is an example, or this is the first year curriculum. So if you were going to join for just the certificate, or if you were working on the master's degree, this is what you would take in the first year. And you can see the types of classes that are held. So obviously in term 1, there are some online requirements that you have to complete related to research ethics and online learning. But the true coursework is built around the essentials of population health management, a course that really gives you a broad overview of essentially what you're going to be learning for the entirety of the program, but helps you just get a sense of the various aspects of population health and population health management. There are courses in advanced payment models. It's one of the ones I teach. In the first term, we have a course on collective impact. So we talk about cross-sector collaboration. We have courses on quality, consumer and population health informatics. We do require EPI, and we do require at least one course in biostatistics. We think that's very important, particularly if you think about, population health and trying to stratify your populations. Understanding, epidemiology and some of the statistical concepts are very important to all of that. And then finally, we have a course, Managing Health Across the Continuum, where we really think about, disease management and care management. Many of us may be familiar with it within our health systems, but this is actually thinking about how do we do disease management, care management, lifestyle management across a community, not just our patient population. Next slide. So this is a combination of the year 2 and the year 1 curriculum, which I just covered, as well as the year 2 curriculum. So year 2 is if you would be taking those courses if you were working on the master's degree. You can see we continue with elements of thinking about high performance population health in terms of how we organize ourselves to be efficient and effective in our delivery of community population health oriented care, thinking about how we change behavior and the impact of behavior through health education and promotion. We also look at behavioral economics and how we can use risk and value-based payment methods and incentives to change behaviors, not only within our organization, but also thinking more broadly about our population as a whole. We have a systems thinking course. We have a built environment course looking at the influences and challenges of factors that influence health, such as housing, food scarcity, etc. We have a leadership class looking at value-based concepts of social responsibility. That course is really thinking about how we can most effectively position our healthcare organizations to be cross-sector collaborators, effective cross-sector collaborators, particularly given the fact that many of our hospitals and health systems really haven't had to do that in the past. They've largely been focused on their acute care activities. So this is how do we position ourselves to be a more effective partner. And then I mentioned the integrative activity, which we'll take in the 4th term of your final year. And this is really a focus or an opportunity for you as a student to bring together all of the pieces that you've learned throughout the program to get your master's degree throughout that program to really apply it to a project that you'll be assigned. So again, a very comprehensive program, we think, that gives you a good sense of all the key elements to a population health management program, particularly if you're developing a population health management strategy. And all of this, again, brings together both the public health piece as well as the healthcare administration piece in a very applied way. Next slide. As a school, we have been doing online learning for a very long time, as you can see on this slide. So we think we have a pretty good process for doing online learning, conducting online learning, doing it in a way, these courses are designed in a way to create engagement. It's just not sitting down, listening to a recorded lecture and taking a test at the end. These are actually modules of learning that have discussions built into them. They have synchronous sessions such as this, where we all get online together and talk or have guest speakers. So it's about as close to being in the classroom as you can get without being in the classroom. So it's really meant to be as engaging as we can possibly make it. You do have the ability, of course, to do this online. So from a flexibility perspective, each of our modules from a weekly basis essentially open on Sunday, and they close the following Sunday. And this allows you the opportunity to listen to the lectures at any point during that week, to work on the assignments that are maybe due that week. So it offers a lot of flexibility in terms of how you can approach learning. And the faculty work very closely, I think, with the students. If things come up at work, if family matters, come up, we're very flexible in terms of helping students to work around those things so that the program of learning doesn't necessarily get in the way, but is really a good part of what you do. And there's always access to both faculty and help at any point during the term. Next slide. So this is just a brief summary of some of the faculty that are involved. At the bottom of the screen, you can see that the various departments that are represented. So again, very interdisciplinary. We have faculty in the School of Medicine, International Health, Health Policy and Management, where I am, biostats, EPI, Environmental Health and Engineering. So again, a good cross-sector of faculty that are bringing their particular expertise to this, both from a public health perspective, but also from a practice perspective. So as I mentioned, I spent 35 years in healthcare administration predominantly. in the ambulatory physician practice world, so very familiar with community-based approaches to healthcare delivery. We have other folks that are in the quality regime. We have care managers that are teaching, physicians that are teaching the class. So again, a good cross-section of individuals, both faculty as well as practice-oriented. Next slide. So this is just, I mentioned earlier, we graduated our first cohort of students in May. So that was a tremendously proud time for me and all of the faculty in the population health management program. So our first group of students to complete the master's degree. And we're very thrilled to have one of them join us here today, because you can hear it from her directly in terms of what the program meant, and also the opportunity to ask her some questions. She is graduated in 2019, back in May. Deborah is also a Delta Omega inductee, so this is the Honor Society for Public Health. And she was also the recipient of the Best Population Health Integrated Activity Recognition Award. So her capstone was judged to be, by the readers, the best of all that were submitted of the graduating class. So again, it's my pleasure to introduce Deborah Thompson, Dr. Deborah Thompson, who's the president of Access East and the vice president of clinical population health at Vidant Health. So Deborah, I'm going to turn it over to you, and welcome.
Thank you, Dr. Biddle. It's a pleasure to be here to speak with the candidates who's thinking about this program. I'll share a little bit about my background and why I chose Johns Hopkins Population Health Management Program, and then a little bit about my experiences with the program. Just some background. I began my career many years ago as an acute care nurse in the critical care environment, and over the course of my 36 years, I've had the great opportunity to work in many settings, from ambulatory clinics to home health, quality, some employer disease management programs, and also care coordination. My health system began this transformation through value-based reimbursement models back in 2014, and I realized that I lacked a true foundational knowledge in population health, and really recognized that in order to be an effective leader for my system, I needed to have more self-development. In fact, no one at our health system at the time really had the skill set, and so I saw that as an opportunity for me to gain this expertise and ultimately impact Eastern North Carolina in a very positive way. It's very rural. We serve over 29 counties with over 1.5 million people, so a large geographic area, but extremely rural. When I began the Johns Hopkins program 2 years ago, my responsibility at that time was geared toward overseeing our Medicare Shared Savings Program and the care management program. So we had right at 18,000 covered lives. Today, just so you know, that transition in just a 2-year period, today my role oversees care management for the entire health system. It's all of our value-based programs, which are right at 220,000 covered lives. It includes our Medicare, our Medicaid. I really look at system work, so care management across the entire system. I work with our community partners and help to grow those, and all of that under that population health strategy, which for Vidant, that's one of 2 key strategic focus areas moving forward. And I strongly believe that the population health management program at Johns Hopkins really helped to provide for myself the foundational critical elements that I needed, both in public health and population health, to expand my skills and knowledge so that I can help lead this work for the health system. Today, I'm in a very collaborative role with other key executives from quality and managed care and finance and network, and we really work not only across the health system, but with community leaders as well to help develop those programs for a very underserved rural area in North Carolina. Next slide. Thank you. So I began looking for a population health program right around 2015, and I really looked at many different programs that were out there. And I identified the Johns Hopkins program as the premier program that I really wanted to pursue. And as you're probably aware, I mean, they have a very strong public health foundation, #1 school in the nation, over 100-year anniversary of having School of Public Health. And to me, that was two achievements that spoke very highly of the program itself. The curriculum really addressed some of the core concepts that I was lacking and that I knew I needed in order to be an effective leader. As Dr. Biddle said, the program is based on evidence-based practice, and you hear not only from the faculty but also frontline leaders that are key in their field, making significant impacts on their communities. So you really get exposed to great work that's making an impact. The faculty also are experts in their field, and as Dr. Bill said, they want you to succeed. They will work with you. I found that the assignments really help test not only your knowledge, but your ability to help connect those dots, which I feel is really important to ensure you really are grasping the concepts. I found that the course itself really was applicable to the work that I was doing. In fact, my manager at the time said she really could see the transformation in my skill set as I was advancing through the program. So I knew I had made the right decision early on. I also needed to be in an online program because I work full-time and I'm not in a position where I can relocate. And so with taking this program, I was able to continue working full-time. Also going through the program, as Dr. Biddle said, things in life happen. My immediate manager, there was a change in leadership, and so I had a pretty significant change that last year in the program. And even as a lot of things in my work had changed, I was still able to not only continue the program, but to excel as well. This particular online program was my third program, and I will tell you what, from my perspective, it was the best program of the others that I'd taken in my career. I think the 8-week terms really helped me not only to keep my focus, but it challenged me to stay engaged. The lectures were great, very applicable to the work, and you can apply that. And so it really helped me to move forward. I will say that if you haven't done online programs before, they are very effective, but you have to dedicate time in your schedule to make sure that you stay on target. With terms moving as quickly as these do, you don't want to get behind. Things in life do happen, but having conversations with your faculty, if things occur, it's going to be really, really important. I think self-discipline is helpful too in managing your time effectively. Personally, I found that the program was definitely worth my time and financial commitment as well. Next slide. So just a little bit about the value that I gained. I truly believe that this program prepared me to be in the role that I'm in today, not only at the health system level, but it also opened doors for me to work beyond the walls of the health system. I work very collaboratively with leaders across the entire 29-county region and also across the state. In the program itself, I learned from colleagues across the globe, and I think I have a much better appreciation for how we're all connected and having a role to improving overall health status and working toward those population health targets. I personally gained new knowledge, which really expanded my awareness, and as I said, it really has allowed me to reach out across the state and work with some great leaders. I have a greater understanding of population health and really how to strategically influence and lead change. And so for me personally, the last 2 years, they were great. And if I had to turn back time again, I'd go through the program again. So for me, it was great. So Dr. Biddle, just want to say thank you for allowing me to speak to those on the call today and share my experiences.
Well, Deborah, thank you so much. To all of you that are listening, clearly Deborah is a wonderful student. We're so happy to now have her as an alumni. But I think you heard in the words that she shared with all of us that this program is very much geared towards the working professional, and it's applied and translational in nature. So we want to be as evidence-based as possible, but we also realize that evidence without action is somewhat useless. So we really count on students like Deborah to take the knowledge that you gain from this program, in addition to your other experiences and other sources of learning, and integrating them and actually making a difference. So we're so thrilled to have Deborah here, and she's I think, an outstanding student, is a wonderful alumni, but very typical, I think, of all of our students in terms of the desire to make a difference and use what they learn to improve health in the population. So Deborah, thank you again for joining us today.
Thank you.
Yeah, thank you, Deborah, again for sharing why you chose our program and the value that you gained. I will move on to admission requirements. We do use a centralized application portal called SOPIS for the master's programs and SOPIS Express for the graduate certificates. A bachelor's degree from an accredited college or university is required, minimum of 3 years of healthcare-related work experience, a resume that demonstrates previous healthcare accomplishments. For the graduate certificate, 1 recommendation letter is needed, and for the master's, 3 letters are needed. A statement of purpose that demonstrates how your educational and career goals align with this program. And for our international students, if you have studied internationally, you would need both a course-by-course evaluation by West, or perhaps showing proficiency in English. We do review completed files on a rolling basis, so we do encourage you to apply early. The priority deadline is April 15th for the master's program. Final deadline for the master's program is June 1st, and the final deadline for the graduate certificate is July 1st. We do have 1 start a year, and it begins August 31st for those students that are thinking about a fall admission. For financial aid and tuition information, the cost per credit hour is $1,162. All students who are accepted into the program receive an open scholarship of $446 per credit hour. That brings it down to $716 per credit hour. There are no additional steps that a student has to do to obtain the OPAL scholarship. Again, once you're accepted into the program, you do receive the OPAL scholarship for the length of the time that you are in the program. For those that are interested in financial aid, our school code is E as in excellent 00234. That's E00234. And we do have a financial aid office to support our students with exploring financial aid options. So now we'll open up the time for questions. Again, I'll answer any questions related to admissions, and Mark and Deborah will address questions on the program. The first question is, can we receive a copy of today's presentation? All students who are attending today will receive a copy of this recording. And it will be on our website as soon as it's available in a few days. Dr. Biddle or Deborah, or perhaps both of you, could you expand a little bit more on the integrative activity?
Well, I could start, and then Deborah, if you'd like to chime in, please do. So the integrative activity, just academically speaking, is required of all master's programs. There's a capstone requirement for any master's degree program. Ours is called an integrative activity. Again, you may have heard the term capstone used if you already have a master's degree. But essentially what it's meant to do is be just that. It's an activity that allows you to integrate everything that you've learned over the program. In our program, the integrative activity that was given to the graduating students this past May, so Deborah was one of the ones who completed it. It was a standardized case that was taken from a real county in a real state with real data. And you were asked essentially to to evaluate part of it, and then also to create a population health management strategy around opioid abuse in a given county. So again, it may vary from year to year depending on the nature of what's going on. Obviously, we want to make sure that it's kept current in terms of its application and use, but that's an example of what we've done in the past, or at least this first time around with our first graduating class for the integrative activity.
And I'll just add, Dr. Biddle, that it was a great opportunity to have as Dr. Biddle said, a real life case, in that you utilized your skills and your knowledge from the course to really develop that plan. I found it to be a great challenge, and I think for me, I wanted to go beyond the page limit, because you really begin to develop this plan that you could foresee implementing. So I think the greatest challenge was staying within those page limits, but it was a great opportunity to really pull all of that work together, and it really helped to solidify all that I had learned over the past 2 years.
Thank you, Deborah and Mark. Our next question, I think, is for Mark. A student wants to know if they need a specific academic background to apply or any type of prerequisites.
Great question. So we don't require GRE. So there's if you have not been to graduate school in the past, you don't have to take the GMAT or the GRE. We certainly, look at whether how long it's been since you've been in school, just in terms of your ability to complete graduate work. Again, if you've never had a master's degree and this is your first master's, we do look closely at your undergraduate transcript, albeit we take into account that it may have been years ago that you've completed that. We are looking for relevant, and I put that word relevant in quotes, relevant work experience. So ideally, we're looking for individuals that are, sort of mid-career, or plus or minus, and that so have at least 5 years of experience in healthcare. Part of that is really driven by the fact that this is a graduate program, and we don't really, so we do expect some baseline knowledge of the U.S. healthcare system, that you understand what value-based payment is, and understand who CMS is, and some of the terminology of the U.S. healthcare system. As you know, there are a lot of acronyms in healthcare in this country. So we do look at your CV and or resume from that perspective, just to make sure that you are working in healthcare, you have a good sense of what the U.S. healthcare system is, and that you are reasonably well positioned to be able to be successful in graduate school. So outside of that, we don't have any other, prerequisite per se that we're looking for. It's just really your experience. And we are very interested in different perspectives. So for example, one of the students that was admitted this year actually is an editor for one of the big health journals, is one of the editors in Health Affairs. So again, it's just interesting that we have a number of people coming to the program with different perspectives on healthcare, and I think that really helps to enhance the learning opportunities, the peer learning opportunities for all of our students. So I hope that answers the question.
Thank you, Mark. And this leads into the next question. We have a student that wants to know, how does the program help the non-clinical professional?
I would probably need some clarification on what a non-clinical professional is. If that means that they're not a nurse or a doctor or some other licensed clinical individual, obviously that's not important per se, and maybe Deborah can speak to that as well. I think we're looking at people who work in healthcare either in a clinical, as a clinical or a clinician. So for example, a medical director, a nurse, a social worker, pharmacists, et cetera. Or it could be, folks that are in administrative positions. They may be administrators, directors of programs. Part of my background was a service line director for orthopedics. So, those types of individuals would certainly do well in the program. That, again, there's no need to be clinical if that was the nature of the question.
And Dr. Biddle, I would also add, with the emphasis on community partnerships, to many community organizations, people who would be in those roles, I think would be a great fit for the program as well, that are in the communities, grassroots, making change happen.
Yeah, absolutely. I think, we would love to see more enrollment from community-based organizations, public health departments. We've had some of those, but we're certainly looking to enhance that as well, because this program was really meant to create a bridge between healthcare and public health, and I think it helps both sides, the public health side, if you will, and community-based organizations, those in the community, and the healthcare side, to really create a common vocabulary around which they can build successful partnerships.
Thank you. The next question, what are the resources with questions on assignments? How do they get support in the classroom when they need assistance? I don't know, Deborah, if you want to start with that.
Definitely. You have ongoing communication, discussion boards. There's a lot of group activities, but your faculty are readily available to students, and I think we also help to work in teams for each other too. So there's a lot of support, not only among the students, but also in the collaboration and communication with your faculty.
Yeah, I would just add to that, there are any number of ways that students are supported during the course. I just wanted to mention or highlight something that Deborah mentioned earlier. Our School of Public Health operates on a quarter basis, so not semesters, but quarters. So these are 8-week quarters, and there are 4 quarters in an academic year. So the term, as I use the phrase that I use is term, the quarter goes by very quickly, of course, 8 weeks. So it is important in these online courses to really stay current and keep up. But to the extent that issues come up, again, there are a lot of resources out there, not to mention the primary faculty teaching the class. There are teaching assistants that help with the class as well, so they're available for questions. We have discussion boards for students to be able to post questions either about assignments, logistics, technical issues, all of which are monitored all the time. The students themselves are very good. It's amazing to me how, and again, Deborah could maybe speak to this a little bit, but how close the group of students became, because many of them sort of go through the classes together. So they get to know each other. They work on projects in various classes together. We try and work very hard about setting up groups, because this is a virtual program in the sense that there are students from across the country in it. for example, I'm teaching a class this term right now that has group projects in it, that we try and match people up by time zone. So, you're not necessarily on a committee or a group with an East Coast and a West Coast person on it. So we do try and match it up so that the students can effectively work together without too many hurdles or barriers. But they really do reach out to each other if there's if they're not really certain about maybe they're having trouble with their biostatistics homework, and they'll form a little study group. I've seen that happen in the program. We do have other resources that we can target you to. So if you are not really, if you never had biostats before and you're coming into the program, we're going to suggest to you that you do a introductory biostats course, and we have some links to those. Not necessarily in our school, but they're just links so that you can sort of self-educate and get yourself sort of grounded in some of those things ahead of time. So we do work with our students to make sure that they have the resources they need.
And I'll just add that the study groups, which we formed outside of the requirement of the courses, was extremely beneficial to all students. And even we had people across the globe in our program. We still would offer, like on weekends, 2 sessions that anyone can join. Oftentimes, some of us joined both sessions so we can learn from other students that were participating. But you do learn to help support each other during the course of the 1 or 2 years that you're enrolled. And what was amazing for us, and I'll just share that when we finally got together at the very end, it was interesting to really meet the people that you've been working with that you hadn't had a chance to meet before. It was like a family reunion where we had never seen each other before, other than pictures on the website. So that's pretty cool.
The next question has to do a little bit more with time commitment. With 18 to 20 hours a week dedicated when you're taking 2 classes, can you elaborate a little bit more on what those type of assignments look like each week?
Well, I'll start, and then I think it would be important to hear Deborah's perspective from the student. So academically, it's most of our classes are 3 credits, and the rule of thumb essentially is, if you think about being in a classroom, sitting in a seat for 3 hours a week for your class, or maybe 2 1.5-hour classes per week. So there's your 3 hours, and then typically you double that for outside of class activities. So that could be readings, homework, research papers, all the things that you have to do. So essentially, for a 3-credit class, you can roughly approximate 9 hours a week of work. So yes, if you're taking 2 per term, that would be roughly 18 hours a week of work. Does it work out to be 18 hours? Yes and no. I've done part-time. I did my doctorate part-time, so I'm familiar with what it's like from a student perspective. But again, what we try and do, because there are 2 courses per term, the 2 faculty who are teaching in that particular term do their best to coordinate activities, so that we're not duplicating a lot of effort. For example, if I know the other teacher who's teaching the other 2nd term class is doing a lot of group work, I may not give any group work in my class, just to try and create some sanity out there for the students. We try and assign groups so that you're in the same time zone to make it easier to coordinate meetings. So we do coordinate amongst ourselves as faculty to make sure that our classes are not, for example, we do live talks. Typically there's 2 or 3 a term when we get online just like this and talk about a topic, or we invite guest speakers to speak. We try and, again, make sure that they're not happening on the same night, so you don't have to decide which of the live talks I'm going to go to. They're all recorded, so if you miss one, it's no big deal. You can always listen to it at a later time, but it's interesting. A lot of our students really enjoy being able to participate in those. So assignments really vary by course. Many of them are paper-driven types of assignments, case studies that you work on. where you're being asked to apply the materials that you're learning. Some have quizzes. Most of the quizzes are not significant portions of your grade, but rather really just to make sure that the key concepts are really being absorbed during the course of the lectures. And let's see what else. And the group work, a lot of some of the papers and cases that you work on might be individual assignments, and others tend to be small group assignments. I teach a leadership class in the program, and one of the things that we had the students do is produce a workshop video. So this was using VoiceThread, essentially a voice over PowerPoint software. But it was basically to work together to produce an 8-minute video on a leadership topic of their choosing. So again, it varies by class, but I would say, for the most part, it's typical types of assignments that you would see in a normal, residential kind of program where you're in class that you have to do. Readings are all posted online. So again, you can download those and read them at your convenience. But they're there to supplement the materials that are covered in the lectures. All the lectures are, of course, recorded. Those are available to be downloaded. You can download and print the transcripts if you wish. I will say that is not counted into the 9 hours a week. I do know that there are students who like to download and print all of the slides, download and print all of the transcripts of everything that's being said, download and print all of the readings, so they have paper in front of them. I'm kind of that kind of person, but that's a lot of downloading and printing, and you're welcome to do it, and you're able to do it, but that just adds additional time to the work.
And I'll just add that I travel 2 hours a day, so I had a planner, and I basically at the start of each term would, because you're given your assignments and when things are due up front, and I had my planner, and that planner went everywhere I went. So when I was traveling 2 hours a day, I was listening to lectures, and so I tried to schedule the work that was needed within my day expectations, and so I utilized what some people may see as a dread. Driving 2 hours a day to me was an opportunity for me to hear those lectures and have dedicated time, so when I got home in the evening, I could then focus on the readings and the assignments. But balancing that and planning that out is really important.
And I was very happy to hear Deborah say in her presentation that of the other online classes courses, programs that she did in the past, that this was, the most organized, because we have put a lot of thought, the faculty have put a lot of thought into these so that we can basically front load everything. So it's all laid out, all the assignment due dates are there, everything is what you need to know to be successful in the course, and you see it right from the beginning. Typically, that's what the first live talk of every term is about in a course, is just going over what's there, what the assignments are, making sure people understand it. So again, we've tried to really be as prescriptive as possible, just recognizing that everyone has very busy schedules, and this allows them to pre-plan the work into their already busy schedules.
I'm going to read this next question. This is from somebody in Canada. Though population and public health in North America is similar, will it be more biased towards USA, or does it deal with general concepts which will work in the Canadian healthcare system as well?
I'll take a stab at that, and Deborah, if you want to add to it, please. We have students, so far we've had at least 3 students each year from Canada, and I think they've all been very appreciative of the differences between our 2 systems, but also I think have appreciated the generalizability of the concepts that we talk about in all of the programs. So yes, I would say you will hear the term or the phrase U.S. healthcare talked about quite often in many of the classes, but I would say the concepts and the ability to apply those concepts would really lend themselves to both health systems.
I think this may be our last question. What time are the live talks typically?
Great question. So I recognize, every faculty does them a little bit differently, but typically they're in the evening. I start mine at 7 p.m. East Coast time. I do that because I recognize that we have students, on the West Coast and other time zones. So it at least allows people to get home if they want to get home and listen to the live talk from home or participate in the live talk from home, or they can do it, towards the end of their day, hopefully, which is a little less hectic at work. All of the live talks are recorded, so they're not, and nobody takes attendance. I mean, we do monitor it because you are essentially, it's helpful to listen to them. There's always useful information, not just because of the guest speakers, but we'll often talk about upcoming assignments or clarification of assignments just to make sure everybody's on board with things. So they're very useful, and we do encourage people, if they miss them, to listen to the recording. So if you're not able to attend one, it's not a big deal. It's not held against you. It's just strongly encouraged, and the technology is there for you to do that. But usually, for all intents and purposes, they are in the evening, so that folks have time to listen to them after work.
Well, thank you everyone for attending today's virtual open house. If we did not get to your question, someone here on our team in admissions will contact you directly in the next few days. And you can reach out to me directly for further information on the program or the application steps. My contact information is on this last slide. And we do have a dedicated admissions team who is looking forward to working with you. Thank you again, Mark and Deborah, for providing such great insight into the program.
Thanks, Kelly. Thanks, Kelly and Deborah, for joining us. I really do appreciate your time today and wish you all the best. Kelly, I just want to point out your email address is missing a U there, just so that folks have it. It's jhu.edu.
Thank you, Dr. Biddle.
Thank you for the opportunity also.
All right. Well, thank you, everyone. Have a great day.